All right there, as promised, I'm going to show you 3 different ways to stretch the hip flexor so that you can eliminate and prevent back pain. This is by far the #1 single most important muscle to take care of in your body. It's also the most common muscle to become dysfunctional because we sit too much. Remember, it sits in front of the thigh. The first one I'm going to show you is my favorite, but I'm going to show you 3 versions because sometimes we have pain in some parts of our body that doesn't allow us to move into the position that I'm going to show you. So I'm going to show you 3 modifications of the stretch. So we know that we need to have hip extension, we know that we need to have hip rotation inward, and we also know we need to have hip side-to-side motion, and the muscle lies in the front of the hip. So the first version I love to do is to get on my knee, and this is why some people might not like this because of knee pain. We're going to get on the knee. I've got one foot way in front. I've got my hip ability to slide forward, and when I slide forward with my pelvis, I get a little nice stretch in the front. Okay, so we're going to kind of gently glide into that movement. I do want to note that I want to try to keep my lower back flat and not arched. And I do that by tilting my pelvis back. That locks my lower back out of the equation, and then I can get more motion in the hip. So I start with 30 seconds front to back, moving my hip. Again, I feel a nice pull right in this area, in kind of the front of the groin. Then I'm going to go into a side-to-side motion with my hips. Okay? I'm going to do that for 30 seconds. Then I'm going to roll my hips or make my hips go around in counterclockwise circles, maybe 15 seconds counterclockwise and 15 seconds clockwise. Then if I don't have any pain in my back when I do this, I'm going to take my hands and go through 30 seconds to the front to back, 30 seconds side to side, and then 30 seconds where I turn left and right. And then I'm going to go ahead and switch legs. Okay, so I go on the other side. I go through my pelvic drivers front to back, side to side, and then around in circles. And then I do my hand drivers forward and back, side to side, and rotation left and right. I do this every single morning. And for you pet lovers out there, your dog does this every morning too. If you notice after the dog wakes up, the legs go way far behind and he does a nice big stretch. He's stretching the same muscle that we, for some reason, don't stretch every day. So that's version #1. Version #2 is going to involve a bed or a table or something elevated. And this is the least likely to cause a problem. It's also only done in one plane of motion. So it's the safest, but it's maybe not the most effective. So I want to get right on the edge of the table here. My hips are almost falling off the edge. I'm going to lay back, but I'm going to bring one knee and tuck my knee way up into my chest, and then I'm going to let my other leg just hang down. And I'm going to let gravity basically just let that leg hang down. And I'm going to lay here for about a minute, and I'm going to switch sides. Okay? So that's the easiest, least stressful version, but it's also the least effective. And now we're going to go into version 3, which is standing. The reason I don't like this one as much as the kneeling version is because sometimes if it's going to involve my ankle. And if my ankle is a little tight, then I may not get as an effective of a stretch in my hip. And so what we'll do, version 3 is going to be more upright. I like this if I don't have ankle restrictions. I don't like it if I have ankle restrictions, if my calves are tight. So what you'll do is you'll get an elevated surface. So the higher, the more intense this is. I'll put my foot up on this chair, and I have my other foot way back here. Okay, and I'm going to make sure this back foot's nice and straight. Right? The knee's going to stay straight. I'm going to stay tall. I keep my lower back nice and flat, and then I just gently start to go through those same motions I was doing in version 1, where I go front to back. You don't have to keep the heel down back there, but you do need to keep the foot straight. I go 30 seconds front to back, side to side for 30 seconds, and then around clockwise 15, and then counterclockwise for 15, and then I switch sides, and I go through that same routine. So there's 3 really simple versions that I could make many arguments for why that muscle is the most important to stretch. It's the most important to stretch. It's the most common that people have a problem with, and so I'm giving you a special sneak peek into the book that I wrote about this subject, back pain. But again, this is something that I would encourage all of you to do. Thanks for listening.